FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening and perhaps even watching the Financial Survival Network. I'm Kerry Lutz, and today is July 10th, 2020. Well, COVID, what's going on with it? Science, policy, have we blown it? Is this a huge economic catastrophe leading to a humanitarian catastrophe beyond all belief? Well, with me now is Jon Miltimore. And Jonathan, you are managing editor of FEE.org, which is a great site. And I highly recommend that you check it out, the Foundation for Economic Education, of which there is far too little of in this country and the world over. And well, John, you've written a couple of articles about it. One is 3 states account for 42% of all COVID-19 deaths in America. Why? And the other modelers were astronomically wrong in their COVID-19 predictions. One thing, guys, I'd like to get your opinion out there. Why don't you email us, let us know what you think of the COVID-19 debacle here, what it really is, and how badly it's been mishandled. So, John, your recent article, you're talking about New York, New Jersey, Massachusetts, 42%. In addition, somewhere over 40% of the COVID deaths have happened to people in nursing homes. In New York, we have hashtag Killer Cuomo. In New Jersey, we have hashtag Murphy the Murderer. I mean, these governors recklessly sent infected patients into nursing homes where they knew up front massive death was going to result from it. What's your take on where we are now and where this COVID thing is headed?
Yeah, I think that policy really hasn't gotten enough attention. And if you look now, like most media attention is focused on rising cases and things like that. But you did see these were really hot spots, for COVID-19 fatalities, unfortunately. And to his credit, Andrew Cuomo came out and said, "Look, we're stopping that policy. It's not working." But that doesn't change, certain facts. And New York came out with their own report this week that admitted that about 6,000 plus residents who were carrying COVID were sent into nursing homes. And I think Cuomo, was New York warned about this and what could potentially happen? They were. State officials were warned by trade association leaders, by nursing home, officials themselves, but they pressed on with the policy. And I do think that it caused severe damage to nursing homes.
And, the lack of accountability, responsibility from Cuomo, the lack of empathy, of sympathy for the victims of this policy, to me is shocking. Not to mention, he doesn't care about people in businesses who are being shut down, potentially thrown out on the street. He has no compassion. And this seems to be a pattern among these governors of many states, and they just happen to be blue states for the most part. You look at Whitmer from Michigan, and she couldn't care less about the economic impact of her policies.
Yeah, like one of the things when you look at this, I do think everyone is trying to get it right. What the big problem is we really disagree on what is the right thing to do. How do we handle this? How do we tame the virus without destroying economies, without seeing a huge increase in depression and overdoses? That's an article I'm working on right now. It's been a very underreported story that overdoses are skyrocketing in the U.S. and we have pretty good data on that front. And I think all the attention is paid to, we're protecting people by keeping them at home. People don't look at the negative consequences that are also associated with that, and they're severe. Increased drug and alcohol use, increases in depression. The economic fallout, everyone knows. We've had 40 million, jobs lost. We've had hundreds of thousands of businesses that are destroyed. And those things matter. Like we've seen global poverty is going to be increasing for the first time since the 90s. And we have to be aware that there are consequences to these policies.
For certain. I mean, everything, unintended consequences, that's kind of the way the government works. For many, many years, I remember Milton Friedman talking about in one building in Washington, D.C., there's agencies that are subsidizing tobacco growth and promoting the tobacco industry. In another building, there's an agency that's bemoaning the negative effects of cigarette smoking and how awful it is, and that we're killing people. People are dying from it, and these two agencies are fighting it out against each other. Eventually, health won, but that went on for decades, where you just got government agencies working at cross purposes. It's nothing unusual. What about the concept that the studies have just shown, particularly the Michigan study in 2,000 patients, that hydroxychloroquine in a cocktail with antibiotics and zinc actually lowers the death rate by 70%. The media comes out when Trump says this could be a game changer and immediately just demonizes Trump and hydroxychloroquine, resulting in several governors actually ordering the pharmaceutical industry to not, the pharmacists in the state, I'm thinking of New York and Michigan, to not dispense it to patients. Don't they need to have a day of reckoning as well? The media, the mainstream media, for this kind of behavior?
Yeah, the reaction to that was, it wasn't hard to see, right? When Trump says up, a lot of times the media are going to say down just because Trump said up. And that was a really good example of it. And, with the drug, I didn't really have much of, input on that. I'm like, if patients are dying and they think this might have a chance to help them, they should be allowed to take it. We don't have time during a pandemic to go through 5 years of FDA approval on a drug. So, instinctively, I kind of said, hey, this might be something that works. And now, after months of poo-pooing that approach, we are seeing the research is coming out and that it's been, quite successful. And it's probably saved, thousands and thousands of lives. But I think you're right. I don't think we're going to probably ever hear too much of a mea culpa.
Yeah. And speaking of the good old MSM, the lamestream media, the number they're focusing on now is total infections, cases. And if ever there was a number that is really not very relevant, it's that number, right?
FSN Radio. It's all about what's next.
Financial Survival Network is brought to you today by Orin Resources, a junior exploration company with the appetite of a major. It's hot on the trail of the next globally significant discovery, creating enormous potential upside for you, the shareholder. Orin is one of the most aggressive exploration companies pursuing high-grade, scalable gold and copper deposits, and has a premier 7-project portfolio, including its 2 flagships, Committee Bay in the Arctic and Sombrero in Peru. Orin's unparalleled technical team and highly experienced management has a history of success in advancing and monetizing exploration assets. No wonder Orin's been called one of the best in the junior exploration sector. Orin trades on the TSX and the NYSE under AUG. To learn more, go to orinresources.com. That's AURYN resources.com.
The Financial Survival Network. It's all about what's next.
Yeah, there's certainly been an undue attention in that area. And, some of the increase is from testing increasing. Other of it does look like we are seeing, a sort of a resurgence of the virus. But I think we always did anticipate that to a degree as economies, reopen, there is going to be, a greater spread of the virus. And I think mortality is the number one figure we should be looking at. It at least belongs in the narrative, right? It belongs in the story. And we're not really seeing that. And, for consecutive days, we had fatalities to COVID in the U.S. hit 3-month lows on the 4th of July and the 5th of July. And I don't think Americans had any idea that happened because it wasn't reported. So I think we do need to, if you want to pay attention to case numbers, okay, but we also have to keep deaths in mind. And that's really what this is all about. We don't track how many, people get the flu right? Nobody says how many people got the flu last year. We talk about how many people died of the flu. And I think that makes sense for all of these things, because if healthy people get COVID-19, that's usually not a problem, especially if you're under 45 years old. Stanford epidemiologist Jon Miltimore came out and said, if you're under 45 and healthy, the fatality risk for this virus is almost zero. So, case numbers by themselves aren't of great concern. What we really need to be doing is focusing on the at-risk populations who this virus is very hard on them. The fatality risk goes up to 20, even 25% if you're very, very old and have conditions. This is, it can be a hell of a virus.
Yeah, and Governor Kemp of Georgia, he was the first one to reopen sometime in May. I don't remember the exact date. I think early May. And he's called reckless and all these things. And, there's been a few days where 20 some odd people have died in a state. May 21st, 78 people died. June 8th, 77. But pretty much the rate has been heading lower. During the July 4th weekend, one person died on July 4th, 3 people on July 5th, then it spiked up to 18, 20 people. But clearly, this was the first state to open up, and he opened everything up, and nothing happened.
Yeah, another example of that is Wisconsin, my home state. I was born and raised in Wisconsin. And if you remember, the Supreme Court ordered that state to open. It wasn't the governor. And they have not seen some big resurgence in COVID-19. Some states have, when we hear about it a lot. In Florida, Arizona, Texas, there's a lot of attention on their case numbers. They're going up. But my concern is if we worry about those figures too much, we are going to work ourselves into a panic again, and we'll find ourselves closing down mass sectors of the economy and doing, frankly, more harm than good.
Yeah, for certain. I could not agree with you more. But once the political arena gets involved, there's kind of no going back. And this should be something that's dictated by data and by facts. But, the one thing, you hear somebody under 20 dies of COVID, it's headlines all over the place. And that makes the general public believe that these younger people are susceptible to succumbing to the disease, when in fact, that is extremely, extremely rare. Just, actuarial tables show that young people don't die as much as older people do. And really, I'd love to see the actuarial tables on COVID-19. Haven't seen it yet, but maybe we will. And the fact is, most people are recovering from the disease. In Texas, the average hospital stay went from 7 days to 3 days. And of course, that doesn't get reported either.
I didn't know that. That's good. That's interesting to know.
Yeah, the less ventilators, less people being put on ventilators. Younger people are going to get hospitalized who do get serious effects and all these things. So I guess we're just going to have to let this thing play out, and hopefully the opportunistic politicians won't overplay their hand and really hurt vast portions of the population in the process.
Yeah, you raise an interesting point that my wife is always, she reads more about this stuff than I do, I think. And she's always like, these news stories, they don't ever tell you the age of the victims. And, when you actually are able to find that data, like up here in my home state of Minnesota, it was like the median age is like 80 years old. And that doesn't mean I want 80-year-old people to die, but it does put the virus in context. And if you look across the U.S., numbers like that they're very similar. This is a very, very deadly virus for people in certain age ranges and who have certain health conditions. But I don't think it merits the widespread fear we're seeing. As you point out, for younger people, they're going to have a harder time with influenza than they are with COVID. It doesn't mean we shouldn't take precautions. It doesn't mean that we want to be spreading the virus everywhere. I think we should be taking prudent, reasonable precautions, but closing down entire sectors of the economy and having healthy people remain at home under basically house arrest, that's not prudent or reasonable.
Yeah, it's the very definition of madness. Well, Jon, really appreciate you coming on. Just tell us, we want to find out more about you, read your work. Where do we go?
Hey, we're at FEE.org, the Foundation for Economic Education, and you can read all about our stories there on freedom, economics. We're reaching a lot of people that are younger and trying to show them the value in understanding economic theory in practice.
Yeah, and it's very important, as we're finding out now. Economic well-being translates often into physical well-being and better health, and economic disruption has the opposite effect. So that's something to consider. Anyway, if you've got any questions for Jon, myself, email us kl@kerrylutz.com, website financialsurvivalnetwork.com. Jon, thanks so much for coming on.
Hey, thanks a lot, Kerry. Appreciate the invitation.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.